So this seems entirely different than court access. Is there a reason that this can't just be two different bills?
Senator Latz.
Madam Chair, Senator Holmstrom, first of all, I would argue to your previous bold statement that perhaps some increase in health care costs is justified for purposes of the ends intended to be here, which is to create the ability for people who are concerned about immigration enforcement being brought against them to get health care in our health care facilities without being afraid of being detained. And in fact, I would suggest if this encourages them or facilitates them getting to the less expensive forms of delivery of health care in health care facilities, rather than waiting until their medical condition degrades to the point where they need to call an ambulance and be delivered to the emergency room, which is the most expensive way of providing health care, then this would actually provide savings in the healthcare system. So unless you've done the research on how all of those things would interact, I don't think any of us are in a position to try to speculate about any number, whether it's positive or negative here. Now, as to your second question, with regard to why don't we just leave it at the courts, it's the intention of this committee to assemble a comprehensive bill that includes a variety of like circumstances, rather than send all the bills out separately. So you haven't quite figured out yet why we laid over all of the bills that we did. The possible inclusion is going to happen tonight.